morning to everyone. Professor Inaugural, Organizing Chairperson, Professor Javed Lakshmani, Organizing Secretary, Administrator Associated Hospitals, Mr. Mohammed Shafakar, Head of Department of GMC Srinagar, guest faculty from within and outside the equity of JNA.
To achieve our best together. Professor Dr. Inaugural Shah, her vision has been most essential in bringing this conference to fruition. Please give a huge round of applause for our head of the department, Professor Dr. Inaugural Shah.
It is my great honor and privilege to welcome you all to the first annual Critical Care Update Conference and Workshop happening today in our region for the first time ever.
Spirit of excellence. Through his tireless efforts and throughout his approach, he has brought our vision to life. Sir, your encouragement and guidance have been crucial in shaping this conference. Thank you.
We are very much thrilled to have been able to gather such a distinguished group of professionals from around the country who share a passion for advancing patient care in this vital field.
कश्मीर कश्मीर मेरे जन्नते कश्मीर कश्मीर मेरे जन्नते कश्मीर तू कहकशा तू आसमां रे रवा जन्नत निशां ये वादियां ये चोटियां ये कोहज़ार ये आबशार है गुलबदन तेरा बागबन कितना हसीं तेरा चमन तू हूर है पुरनूर है तेरी सादगी पे गुरूर है।
It's a unique opportunity to expand our skills in a field that is transforming the landscape of patient care. Whether you are a beginner or looking to refine your abilities, POCUS empowers us to make more accurate and timely clinical decisions right at the bedside.
This workshop is designed not only to introduce you to the fundamentals of ultrasound, but also to provide hands-on experience under the guidance of our expert instructors. With the increasing accessibility of POCUS technology, it has become a vital tool in emergency rooms, ICUs, and various specialties.
The advantages of POCUS everybody is familiar with. It can be done at the bedside, it's very quick, easy, and non-invasive can be repeated as many times as is needed, keeping in mind the dynamic nature of the
Thank you for giving me the opportunity to speak for ultrasound physics and artifacts. After ma'am left you with advancement in AI, I want to take you back into like 19th century when ultrasonography came into vogue with the concept of echolocation. Basically, when they saw bats, despite being blind, they were able to recognize obstacles and steer through obstacles. And in experiments, they took their ears out and they could do the same thing. And it was believed that something is with the reflection. So this was the echolocation. Then during they devised these are like crystals, and slowly it formed in a very wide modality that we use in modern medicine. So
एयरवे का मतलब क्या है?
ऐसा रास्ता जिससे हवा पास होती, airway. तो how can we scan? How can an ultrasound scan an airway? या otherwise lungs में क्या होता है? हवा. तो जब air is a bad conductor of all the beings, how can you scan it from ultrasound?
Yes. So as you can see, ultrasound has been found to be superior to physical examination and just finding out whether there is a congestive heart failure or COPD, and how to differentiate between those things we will discuss next.
ट्रायंगल दिख गया हमने EU करूँगा तो बुकल कॉर्ड दिख
Have first a master demo of the airway, lung and diaphragm. Then for 5 minutes, then we'll go to the each respective station and we'll practice that on hands-on there. Okay. So first thing is the airway. As I told you, for airway, it's a superficial structure. You always use a high-frequency linear probe. Okay. Each time you do, you have to find out what is the orientation of the probe or Dr. Jahid did. As you can see here on this.
These are vocal folds. This triangular cartilages that cartilage. This is the movement of vocal folds. So you can assess.
Movement आ रहा है.
I'll follow you for
ठीक. मेरे नीचे चलिए. नीचे अब देखिए. नीचे धीरे से. ये हमारे यार का चलाएंगे.
The beauty of this is we can take measurements. We can measure it from this end to this end so that it will correspond to our tube size. Our tube size should be always, the external diameter should be less than what we get here.
से देखूंगा मेरा क्या हुआ हाल। मेरा हाल हुआ कि दोनों को
पहचान ले, हर सुबह का नया असर नई कहानियां लिख दे। Assalamu alaikum and a vibrant good morning to all. Welcome to the day 2 of our conference and a special welcome to the guests and delegates joining us today. I, Dr. Muskan Manzoor,
And I, Dr. Sana Khan,
will guide you through an enriching day filled with insights and updates in critical care.
नई सुबह की रोशनी हर दिल में छुपी है। नई सुबह की रोशनी हर दिल में छुपी है। उठकर देखो तो हर ख्वाब की नई जुबां खुली है। Today isn't just another day, it is a canvas for creativity and collaboration. So let's dive deep into the world of critical care. Let's embrace this energy and talk with our experts, embrace panel discussions and interactive sessions that are sure to leave us more informed and inspired. एक साथ मिलकर चलो सपने सजाएं। एक साथ मिलकर चलो सपने सजाएं। उम्मीद की राहों पर नए इरादे बनाएं। सीखने की राह में कोई मंजिल नहीं है। सीखना ही तो राह है। सीखना ही तो जिंदगी है।
Professor Dr. Naveed Nazir Shah sir, Head of the Department Pulmonology.
Commonwealth Academic Staff Fellowship in Liver Transplant.
Intraoperative findings show brain minute pulsatile, non-edematous, acute SDS, right frontotemporal region. Procedure was decompressive craniectomy was done and
The hypoxic effects of oxygen are well read, well studied. The typical FIP we know that in atmospheric air it is 21%, but there is an upper limit. The maximum safe limit is 23.5 and the lower limit is 19.5.
I think the patients that were chosen for the study, they were very heterogeneous group. I just saw they had CA patients, there were COPD patients. So which ones got allotted to the LIV group and which ones got allotted to the HFNC group? Sorry, high flow basin.
tell the truth, God has created oxygen 21%. Can you imagine? As you accept, 19% is low, 23% is high. So we believe in Allah. That's
between 92 to 96%. Because there is some safety, unless there are some recommendations, till now.
What to talk about these operators? We find most of the cases who are critical inpatient, who need maximum experience, most experienced person to handle it. We see that tier 1, tier 2, tier 3, or the junior assistants are managing. So in a critical inpatient who are supposed to be managed by the most senior person, we are managing those intensive care with the junior most person. So naturally that itself is something which is more challenging to us. And naturally you can expect the stress of those people at late night or even in the morning hours, especially in an inexperienced person, is always there very high. So naturally prediction of anatomically difficult airway is always an important factor, but to be honest, we don't have a very good robust system of assessing these patients, because whatever system we have, it is primarily for a patient who's in a different setup or in a How can you spontaneously without protecting the airway?
No, because they are doing laser intermittently. But patient is spontaneously breathing and we can put face mask. It's just like
always a chance of aspiration that they are looking into it.
I want to avoid tracheostomy also.
So then
that's my point.
That's
why I was doing spontaneous breathing, because they don't know what it is. I think our anesthetists are managing very well so far. Hats off them.
Thank you very much.
बेहोशी का आलम हर मर्ज का दफाए गम।
जब मर्ज ने छीनी हो मुद्दतों से नींद, उस मरीज को सुकून की नींद दे हम।
ये कल्बियात आसाबियात सरतानियात के जब उठ खड़े हो हाथ,
तब तबीबों को आती है माहिरे अवल जरी की याद।
And off the dais, ladies and gentlemen, today's occasion is the first annual critical care conference being organized by the Department of Anesthesiology and Critical Care, GMC Srinagar, in collaboration with the Indian Society of Anesthesiologists. This event marks a great beginning in understanding the recent advances and nuances of the medical science in the specialization of critical care. Now, it is very important to understand that the Department of Anesthesia and Critical Care is extremely
Medical College Srinagar and its associated hospitals, Professor Dr. Ifat Hassan Shah on to the dais.
Distinguished guests on the dais, our patron, Dean and Principal, Government Medical College Srinagar, Professor Ifat Hassan Shah. Our special guest for the day, Director SKIMS, Professor Ashraf Ganai. Our esteemed guest of honor, Administrator GMC, Mr. Ashraf Hakar. Our guest faculty and guests of honor, Professor Dr. Syed Maheed Ahmed, Professor Dr. Kajal Jain and Professor Vimmi Rawari. My esteemed colleague, Professor Dr. Javed Naqshbandi, who is also the organizing secretary. Our national faculty members seated off the dais. My esteemed former heads of department, Professor Basharat Salim sir, Professor Abdul Hamid sir, Professor Farida Ashai ma'am, the distinguished anesthesia faculty and former faculty of GMC and SKIMS, all heads of department of GMC, Principal Dental College, Professor Ejaz Shah sir, the medical superintendents from all associated hospitals of GMC and JDC, and my dear friends and colleagues and students, a very good morning to all of you. It is my great pleasure to welcome you to the inaugural function of the first annual National Critical Care Update Conference and Workshop conducted under the aegis of Indian Society of Anesthesiologists and All India Difficult Airway Association.
Dignitaries on the dais, Professor Mohammad Ashraf Ganai, Director SKIMS, Organizing Chairperson, Professor Hina Bashir, Organizing Secretary, Professor Javed Iqbal Naqshbandi, our worthy guests of honor, Professor Vimmi Jain, Professor Kajol Jain and Professor Syed Maheed Ahmed, Administrator Associated Hospital, Mr. Mohammad Ashraf Hakar. Dignitaries of the dais are worthy Principal Dean, Government Dental College Srinagar, Professor Ejaz Shah, heads of the departments, ex-heads of the Department of Government Medical College Srinagar, Professor Farida Shahi, Professor Basharat Salim, Professor Rafiqa, heads of the Professor Abdul Hamid, heads of the Department of Government Medical College Handwara, Professor Qayyum Saab, heads of the Department of Government Medical College Srinagar, guest faculty, students and their delegates. I, as a patron of this conference, warmly welcome you all to
इशार which was said that मिल जाए अगर समंदर तो दरिया तलाश कर. No. I am saying, so we generally say when we go international and we have age, then you start reducing your horizon. You come closer to your home and you start making money, because we believe in money talks, grammar, nobody chucks the grammar back. So at that moment you जाता है पत्थर की चोट से, पत्थर ही टूट जाए ऐसा शीशा तलाश का. That is the next sequence of what we call as here. And there is one more thing, when you go in profession, if somebody tries to do better, when we go in comfort zones, we don't do much ourselves. Then we get jealous that other person also should not do anything. And Iqbal has expanded on this share also. He says, हर शख्स जल रहा है हसद की आग से, इस आग को बुझाए वो पानी तलाश का. Thank you very much.
Felicitating ceremony. This is a small token of gratitude.
Thank you, ma'am. Huge round of applause, please.
Friends, on the eve of World Anesthesia Day, I, on behalf of organizing committee and all participants, would like to extend my heartfelt appreciation and deepest gratitude to all the dignitaries, speakers, sponsors, and participants who have contributed to the success of
those like me. So the trainees or critical care in the critical care and anesthesiology like MD residents.
Critical care and endocrinology. So this is a useful article describing what is CERSI and how to manage it. CERSI is a dysregulated systemic inflammation which occurs in a multitude of disease processes in the ICU, in which there is inadequate levels of corticosteroids in the blood related to the citrus. So it is a kind of relative.
CRR
and many of them will need RRT. This slide will give probably goosebumps to many here. Reason being, if you see the mortality with AKI, I have chosen only the best cited and the most influential papers from PubMed. You see in these papers, you will find that mortality with AKI compared to mortality without AKI.
It's different developing countries, but over here it's still very challenging for us. It's almost vanished in the West. But there's been a new entry in the recent past in the West where we've seen more and more cases of AKI in pregnancy. The reason being is that because of so much of improvement in diagnostic and antenatal care and treatment of various chronic diseases, various challenging women are desiring to become pregnant, and that's very challenging not only for the obstetrician but also for the clinician and the intensivist.
The developing countries are 5 to 6 times higher than in the developed countries, and the International Nosocomial Consortium has published a recent